Okay. Um, so I'm interviewing Dr. Gibson. She's a pediatric orthopedic. Do you specialize in anything?
Um, well, I'll clarify. So I'm actually not an orthopedic doctor. I work in the Department of Orthopedics. I did my residency in physical medicine and rehabilitation, and then I did a fellowship in pediatric sports medicine. There were two different parts of my fellowship. Three of us were not surgeons, and three of them were orthopedic surgeons. So I do non-operative sports medicine and musculoskeletal pain.
Okay. What degrees have you attained?
Oh, well, let's see here. I guess you go back to, I got a high school degree in Canada in 1995, and a university undergraduate degree in Canada in 1999. It was I majored in life sciences, which is like a pre-med, and I minored in psychology. And it was a Bachelor of Science with honors, and then I got a medical degree in Alabama in 2005, and then I did an intern year in Charleston, South Carolina, for 1 year in internal medicine, followed by 3 years of physical medicine and rehabilitation in Boston at Spalding Rehabilitation Hospital, Harvard Medical School, and then my fellowship was the pediatric sports medicine, which I got in 2009, and that was at Children's Hospital of Boston, also Harvard Medical School.
Okay. Have you ever switched majors?
I did not switch majors, but I always really liked journalism also, and I worked in the summer doing a lot of sports journalism stuff, and if that had been an option at my school, it probably would have been a lot more tempting.
Okay. Describe a typical day. Simply.
The days that I'm here, sometimes we start with 7 a.m. meetings, sometimes we don't. On the days that we don't, then we have clinic starts at 8 a.m. and we see patients basically every 15 minutes to 30 minutes. I try to get done by lunchtime. I often don't. Work through part of lunchtime, then eat quickly, and then start seeing afternoon patients at 1 o'clock. They're supposed to end at 5. Sometimes they do, sometimes they don't. And then I often stay here till about 7 p.m. trying to get my dictations done at the end of the day.
How would you describe your personal level of stress with this job?
I think medicine at times can be more stressful than some other jobs, because you don't want to miss anything for a patient, because it either means that they have more pain or a problem that you could potentially miss could get worse because you miss it. There are sometimes stressful things. In June, I diagnosed 2 children with cancer. One had just come in with knee pain and one had come in with leg pain, and they both were tumors. So that's very stressful. But luckily for me, it's rare. And part of the reason I picked sports medicine is because the really bad stuff happens very rarely. So I think for the doctors that are seeing people with cancer all the time, it's probably more stressful for them than it is for me. And what my residency was in physical medicine and rehabilitation was a lot of rehab for spinal cord injury, stroke, brain injury, burns, stuff that was much heavier, which is why I did sports medicine, because most people tend to get better. So it tends to be a more fun and slightly less stressful area of medicine than some others.
Okay. What difficulties do you constantly face in your career field?
Probably that it sometimes feels like it's never ending, that you're never really off, that even when you're home there are MRI results that come in kind of around the clock. There are lab results that come in around the clock. You can take vacation and get days off, but it is tougher because people still get injured on holidays. People still get injured on weekends. We're supposed to, medicine also involves continuous learning to keep up with all the advances in medicine. It also involves doing some research yourself, and so all of that takes time on top of your regular workload, and that's sometimes the most challenging thing.
We already talked about what you did before you entered your career field. How do you think this helps or relates to your career now?
I think it makes me a more well-rounded person, and the fact that I did mostly sports journalism, I think is kind of a fun tie-in to doing sports now. Ironically, a lot of the journalism I did was with tennis and horse racing, which is not really that, the horse racing not so much a direct link to what I'm doing now, but the tennis for sure, and then the horse racing was fun. I used to work for some of the networks like ABC and NBC, and I'd help cover the Kentucky Derby and Wimbledon and some big events. So sometimes it's just interesting. It was definitely fun, and I think, I don't know, I guess when I do sports coverage from a medical aspect for big events, like I've done the Boston Marathon several times and some big tennis events, I guess that it helps me be used to being around and being behind the scenes in those big events.
What skills are needed to be successful in your career, such as do you need to be athletic or have good social skills or be, not emotional?
You don't need to be athletic, but I think if you have had an athletic background, if you're doing sports medicine, it can help you relate to your patients better. You don't need to have good interpersonal skills, unfortunately, but I think it's helpful when your doctor does, because I'm sure everyone has met some doctors that don't have very good interpersonal skills. And emotional, I think again it depends what field you're in. If you were in a field where you were dealing with sad stuff all the time, if you were a really emotional person, I think it would be very tough on you. You still want to have some emotion to feel connected to patients, but if you were devastated by every single patient you saw, I think it'd be impossible to keep working. Unfortunately, to get into medicine, a lot of the times they just look at like your grades and your MCAT scores and your volunteer stuff, and there's not a lot to weed you out until you get to the interview that really looks at your interpersonal skills, which is a bit of a shame, but yeah, no problem.
Oh, you can, that's it?
Yeah.
Okay, which of your natural talents help you succeed the most?
Probably determination and being a little bit OCD, because you need to study a lot. And you just have to be determined to keep pushing through all the years of being really burnt out and feeling like you can't study for another test, and you just have to. So determination and persistence, I guess, on one hand, and then being a little OCD is good and bad. It can slow you down a little bit, so you may not be the fastest doctor, but you tend to, I think it's helped me find subtle things, or hopefully not miss things that I might have missed if I was trying to rush.
Okay, what interests you the most and the least about your career field?
I really like helping young athletes, or even non-athletes, but who are motivated to get better and who really have a goal and want to get back to their activity. I think what sometimes is the toughest is when you have kids that just don't seem very interested in making themselves get better. That they come in and they're texting on their cell phone, and you try to get them to give you an idea of how bad their pain is, like from 0 to 10. If 10 is when they're hyperventilating and crying and their parents are calling an ambulance, and they're totally in no distress, sitting there texting on their phone, and they say they have a 12 out of 10 pain right now. And you try to say, well, no, because you'd be hyperventilating and crying if you were 10, so can you try again to give me, they're like, no, I told you, it's like 12 out of 10 pain. That's sometimes frustrating when they're...
their attention isn't there.
Yeah. I know me personally, like I deal with pain well, but like
Yeah.
it'll be hurting really bad, but I'm relaxing.
Well, see, you're different because you have a goal of wanting to be active in volleyball,
Yeah.
regardless of, injuries. In fact, you're the other end of the spectrum where sometimes you're the patient that's hard to get to rest long enough to get better. But, so sometimes the kids that either just want me to give them a pill or give them a note so they don't have to do PE, and that tends to be the more frustrating part of the job.
Last question. What advice would you give me in regards to like having experience before you're qualified for a certain job?
Well, most medical schools will want you to do some volunteer work. So I think volunteering in a hospital setting or some kind of clinic setting where you can kind of see what it's like. And then potentially shadowing different doctors during the day to see what it's like. And then taking some courses, that I think there are going to be some courses that you don't like. I really hated taking organic chemistry.
Oh, that's what I'm taking. I'm taking next semester.
Yeah, so some people like it. I didn't, but I had to take it. But then I loved courses like anatomy and neuroscience and those kind of things. So I try to take courses that you like, well-rounded, do some shadowing and volunteering.
Okay, and do you know any doctors here that do shadowing, like orthopedics or pain management?
So we all do shadowing. And there are volunteer positions here, but I think it is, I don't know, you have to go through a certain process.
Like a volunteer to
Yeah,
sign up to background and whatever it is, like
Yeah.
general.
Exactly. So I think they have different, I know that we have medical students sometimes shadow us, and others, sometimes undergraduate college students. We don't get that many high school students, except there is a special summer program where you can volunteer in the summer.
Okay,
Yeah. All right.
thank you so much.
You're welcome. Hope that was okay.
It was awesome.
Yeah, that was more
Today is